Hello everyone, this is Dr. Pooja Bansal, Consultant Gynecologist at Bansal Clinic, Nerul, Navi Mumbai. So, I'm going to discuss today a very interesting topic about menstrual cycle and the ovulation. Now, there's a lot of query around that how do I know what exactly are my ovulation dates, and to figure it out, let's understand the basics of menstrual cycle, how it functions. So, we'll start with from the brain, hypothalamus, there's a secretion of a hormone called gonadotropin releasing hormone. These hormones act on a gland which is a pituitary gland in your brain itself to release a hormone which is called FSH, and the FSH act on the ovary to form a follicle. Now this phase of your menstrual cycle, which is the beginning 12 to 14 days of menstrual cycle, is called the follicular phase. Now in that we are just seeing the growth of the follicle. In the beginning there are multiple follicles are formed, but most of them get suppressed over a period of time, and there's only one or two follicles which grow ahead and forms get ruptured further. Now around the 12th day of menstrual cycle, we do have LH surge, which is a hormone again which is causing the ovulation. Now this LH surge will cause the release of an egg from the follicle, and the follicle will be picked up by the femoral end of the fallopian tube and goes in the fallopian tube for the fertilization. Now if there is any sexual activity during those 48 hours, and if there is a possibility that there could be any fertilization happening, then it will convert into the pregnancy. And if not, if you are not sexually active or if you are not planning a pregnancy in that cycle, definitely the egg will be absorbed by the endometrium itself, and the endometrial lining sets off in the form of menstrual cycle. So definitely it's a whole follicular phase followed by the proliferative phase of endometrium. Now in this is all because of the different hormones which are acting on your ovary and the endometrium. So the lining forms every monthly, and if you're not pregnant, the lining will shed. So definitely menstrual cycle is a part of your ovulatory cycle. It is not the blood which is purifying and shedding off. So it is basic endometrium which has shed off after you have not conceived. Now when to try conceiving, what are the perfect days to conceive? Basically, to rule out that perfect day of ovulation is the time we do the follicular studies. That's the best way to rule out the particular days of ovulation. Or we can definitely use the LH kits available. That also approximately tells us the similar timings of the ovulation. So when you do a follicular study, we know the exact date when the egg is rupturing, and we generally tell the patients to keep relation in those 48 hours to conceive. And if you conceive, there is the basics investigation, that is beta HCG. We get it done around at when you get missed cycle or 16 days post the ovulation. So that is the way we measure the ovulation of the woman. For further queries and information, you can visit the clinic or visit the website. Contact the number shown here. Thank you so much.